Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be starting with the second part of the session which I had already discussed in the previous session. The first part is already discussed in the previous session, that is measures and indicators of health and related issues. So as I mentioned in the previous recording also, that since it's a big topic, so we will be dividing it into two parts or two sessions, and we will be discussing it accordingly. Okay, so again I would just like to say that if you have not yet watched the first part of this particular topic, then please go back, watch that video first, and then come back to this one. Okay, because otherwise you will not be able to keep track and understand. Okay. Okay, so I think we had discussed till the disability indicators in the previous video. So in this session, we will be starting off with the next group of indicators, that is the nutritional status indicators. Okay, so now what do we mean by nutritional status? I think again this is something I have given a brief overview about in the previous session only, that what is how will we determine the nutritional status and what are the main parameters of determining or indicating nutrition, whether it's undernutrition or it's a overnutrition. Okay. Okay, so when we talk about nutritional status, it's a positive health indicator, okay, because nutrition is something which is important for the body, and maintaining or having a proper nutrition, particularly in the childhood, particularly when the child is growing, the kid is growing and developing, both physically and mentally, in that particular point of time in life, nutritional status is very vital. Nutritional status is something which is a very important as well as a positive health indicator. Okay, means it's not like mortality or morbidity, because those are negative indicators. Okay, but nutritional status is a positive health indicator. Okay, so first we will be talking about newborns, then we will be talking about preschool children, then we will be talking about the adolescent age, and finally we will be talking about adults. Okay, so newborns means what? A baby who is just now born. Okay, maybe a few days ago, or a 1.5 weeks ago, maybe. Okay, so when we talk about, or when we need to know about the nutritional status indicator of a newborn, the main things that we need to measure is first the birth weight. Okay, the birth weight is usually the normal range of birth weight I think is between 2.5 to 4 kg when a when a baby is being born. Sorry. Second is the length, and third is the head circumference. Okay, head circumference means this one. Okay, because this is also very important in order to know whether the baby is pre malnourished, मतलब जन्म से पहले ही वो malnourished होके, malnourished as in undernourished होके वो जन्म लिया है, या फिर it's after that. Okay, and they also reflect the maternal nutrition status, because obviously if the newborn is suffering from undernutrition, then obviously it means the mother was actually malnourished, isn't it? It is an indicator of the maternal nutrition status, because if the mother is not taking excess amount of food, excess as in, because we all know that during pregnancy, whatever the normal nutritional requirements are there, as with respect to a female sexual reference, those amounts or those values, okay, if we talk about the vitamin intake, if we talk about the mineral intake, as well as protein, carbohydrate and fats, because protein, carb and fat, they are the the macronutrients, and vitamins and minerals are the micronutrients. So both these macro and micronutrients, they have specific requirements in our body, depending on our age, sex, health conditions, and also our the like the condition. Okay, so all these parameters, it's known as RDA, recommended dietary allowance. So these values, they almost double when a mother is pregnant, when a would be mother, when a woman is pregnant. Okay, because during pregnancy we need to suffice the requirement of the baby also, the baby or the zygote or the embryo which is developing inside the womb of the mother. The uh, the dietary requirement or the nutritional demand of that particular embryo or zygote will also be fulfilled from whatever the mother is intaking as food. Okay, So that's why those requirements are automatically increased. Okay, and the mother need to suffice that particular requirement. So what happens particularly in countries like India, where majority of the population is still BPL, below poverty line, and they're illiterate, they do not have this idea, they do not have this concept, or they do not they are not even aware of the requirement of the, of the necessity. Okay, so in many cases what happens, and besides that, there are issues of, nausea, morning sickness is there, nausea or vomiting is there. Okay, in many cases there is loss of appetite also. So instead of having more, the mothers actually they start eating less during pregnancy, which actually affects the nutritional status of the newborn in a huge extent. Okay, so that thing needs to be regulated. So if we are measuring the head circumference, then the length and the birth weight and whatever in the newborn, and it's actually reflecting the maternal nutritional status. Okay, next, coming to pre-school children, where we need to do anthropometric measurements. Okay, so there firstly we will measure the weight, which measures acute malnutrition, because obviously weight is the direct, what to say, it's directly linked with nutrition, isn't it? If a person is undernourished, he or she will be underweight, and if a person is overnourished, he or she will be overweight. This is something which is very much, straightforward. There is no complication is this. It's in like matlab सीधा हिसाब है. Okay, next we have height. Height will be measuring chronic malnutrition. So now what is the basic difference between acute and chronic? Acute is something which is short lived, okay, which is extreme but it is short lived, and chronic is something which is a long term thing. Okay, if it starts at one point of time, it will go on for a consecutive number of years. So that is the basic difference between acute and chronic. So अगर हमें acute malnutrition देखना है तो हम weight पर ध्यान देंगे, और अगर हमें chronic malnutrition देखना है, then we have to focus on height, because height is something जो rapidly नहीं बढ़ता है, isn't it? Weight अगर मैं ज्यादा खा लूंगी तो एक महीने क्या, 2-3 weeks में I will put on weight, and if I start rigorous dieting, 2-3 weeks में I will lose weight. So weight is something जो rapidly gain होता है, loss होता है, but height is something which एक बार अगर बढ़ जाता है तो वो कभी कम नहीं होता है, और बढ़ने में भी it takes a considerable amount of time. ठीक है, अगर आज मेरा हाइट 5 फुट है, 6 महीने बाद मैं 6 फुट की नहीं हो जाऊंगी. It's not possible. Okay, so height is something which takes a large amount of time to increase. तो अगर हाइट पे हम ध्यान देंगे तो हमें पता चलेगा कि ये मैल न्यूट्रिशन कितना क्रॉनिक है, मतलब फ्रॉम व्हेन दैट पर्सन इज दैट चाइल्ड इज मैल नरिश्ड, वो हमें पता चलेगा कि वो बचपन से ही मैल नरिश्ड है कि अभी स्कूल जाने के टाइम से वो मैल नरिश्ड हुआ है. अगर वो हमें जानना है, देन वी हैव टू फोकस ऑन हाइट. एंड नेक्स्ट व्हाट वी हैव इज मिड आर्म सर्कमफेरेंस. मिड आर्म सर्कमफेरेंस मींस दिस वन, ठीक, हमारा जो डेल्टॉइड जहाँ पे है वहां पे, उसके थोड़े नीचे एक्चुअली. Okay, between our elbow and the deltoid muscle. तो वो भी will give an measurement of chronic malnutrition. Okay, next is growth monitoring of children, very important, whether the growth is happening properly or not, because it may so happen that even after giving proper nutrition to the child is not developing properly. ठीक है, maybe the child is suffering from genetic abnormality, any kind of genetic abnormality. Maybe the growth hormone is not being produced inside the body. Okay, so only giving proper nutrition is not the only key. We also need to regulate the growth. Sorry, we also need to monitor the growth. Okay, so उसमें क्या होगा, measuring weight for age, मतलब age के हिसाब से weight बढ़ रहा है या नहीं वो देखना है. Height for age, obviously height is a very important matter in case of children, because height जो है वो it increases only up to 13 to 14 years of age, both in male and female. उसके बाद height और नहीं बढ़ता है. ओके, सो हाइट बढ़ाने का टाइम हमारे पास 12 से 13 साल तक ही होता है. सो हाइट फॉर एज इज वेरी इंपॉर्टेंट, कि एज के हिसाब से हाइट बढ़ रहा है या नहीं. ओके, अगर 2 साल में जितना हाइट है बच्चा का, 3 साल में भी अगर उतना ही है, थोड़ा सा भी नहीं बढ़ा है, देन दैट मीन्स देयर इज सम प्रॉब्लम. Okay, weight for height, again very important. Weight is to height ratio is very important when, particularly when we are talking about, BMR, basal metabolic rate. तो weight के हिसाब से height सही है या नहीं, क्योंकि जितना एक बच्चा का हाइट ज्यादा होगा, उतना उसका वेट भी ज्यादा होना पड़ेगा, isn't it? And vice versa. हेड एंड चेस्ट सर्कमफेरेंस, हेड और चेस्ट का जो सर्कमफेरेंस, ऑब्वियसली चेस्ट जो है वो ज्यादा ब्रॉड होगा देन द हेड, तो वो भी हमें चेक करना है in case of children. Okay, and mid-arm circumference, which I already talked about. And in case of adults, what we need to do? Underweight, obesity, and anemia are generally considered reliable nutritional indicators. If the adult is underweight, then that means obviously it's he or she is suffering from, if the adult, obviously he or she is suffering from malnutrition. Obesity अगर है तब भी malnutrition, over nutrition में आ जाएगा. And anemia is also a very good indicator of nutrition, particularly again in developing and densely populated countries like India, because in India most of the females, it's thought around 60 to 70% of the females, they suffer from iron deficiency anemia. And many of them, most of them, or rather more than 50% of them, they do not have any idea also that they are suffering from anemia. Okay, I myself know many such, my colleagues, my friends. Okay, some of them know also, but they just ignore. Okay, because the normal level of hemoglobin in a female should be around 12 to 14. That is the normal range for females, and for males it's 14 to 16. So मैंने personally I have seen many of them कि देखा है, उनको पता है कि उनका hemoglobin 10 से कम आ रहा है, 8 आ रहा है, 9 आ रहा है, but they are just reluctant. Okay, they are not even like aware कि नहीं मेरा कम आया है, मुझे बढ़ाना है, मुझे medicines लेना होगा, दवाई लेना होगा. They are not even conscious about that thing. So that is also a reason. And another reason is that it's somewhat genetic also, and it's a it's a after effect of undernutrition. Okay, because through diet, iron is something that we need to supply to the body through diet, through food, through whatever food we are consuming. So if there is not any sufficient amount of iron in our diet, then obviously we will be suffering from anemia. Okay, and it's more in case of females. Why? Because females already have less hemoglobin, less RBC in comparison to males, so that's why they're more prone. And moreover, males have the male sexual hormone, that is testosterone, which actually promotes, okay, it promotes or it stimulates RBC production. And in females we do not have testosterone, so there's no one to stimulate or to promote RBC production. That is also a reason for anemia, more in females than in males. Okay. Okay, so next moving on to healthcare delivery indicators. So we are done with the nutritional status indicators. The next group of indicators that we need to talk about are the healthcare delivery indicators. So these indicators, they reflect the equity of distribution of health resources in different parts of the country and of the provision of healthcare. So first we have the doctor is to population ratio, which is 1 is to 1,222. Then we have doctor is to nurse ratio, which is 2.2 is to 1. Then we have population is to bed ratio, which is 1 is to 1701. Then we have population per dentist, which is around 16,854. Then we have population per nurse, that is 2,501. Then we have population per healthcare, that is 5,000 to 10,000. And then we have population per TBA, which is 0.47 per 1,000. Okay, now coming to the utilization rates. So it is expressed as the proportion of people in need of a service who actually receive it in a given period, usually in a year. It depends on availability and accessibility of health services and the attitude of an individual towards healthcare system. Proportion of infants who are fully immunized. Then we have proportion of pregnant women who receive ANC, that is antenatal care, or have institutional deliveries. Then we have percentage of population who adopt family planning. Then we have bed occupancy ratio and bed turnover ratio. Okay. Now moving on to indicators of social and mental health. Okay, so rates of suicide, homicide, homicide means murder or killing. Other crime, road traffic accident, that is RTA, juvenile delinquency, alcohol and substance abuse, domestic violence, etc. These indicators provide a guide to social action for improving the health of people. Social and mental health of the children depend on their parents. For example, substance abuse in orphan children and smoking are more commonly seen, because in orphan children what happens, because as children, since we are humans, again the same thing which I have mentioned I think in the first lecture also, that as humans we are emotionally aware, we are intellectually aware, we are judgmental. Okay, we can what to say, we can observe things, and we can draw inference from those observations. So these are some of the qualities that only we as humans have. No other living animal or living being has these these properties or these capabilities on the face of the earth. So as like for that we are blessed also, and we are being burdened also. So as a child, when a child is growing, the child needs a lot of emotional and physical support also. Physical to obviously need, but emotional support, mental support is also very important. And that we get that primarily from our parents, primarily from our guardians, isn't it? And in orphan children, what happens that there is that immense lack of emotional and mental support. And as children, we do not have that ability to make ourselves bold enough or to make ourselves strong enough that okay, we will be able to lead our lives in our own. Okay, in adulthood also we face many rejections, we face many emotional turmoils. We go through relationship turmoils and breakups and all. But we as adult, we have that emotional stability, we have that mental stability. But as children do not have that mental stability or mental maturity to reach that stage that I can do without my parents, I can do without my mother and father. Okay, besides financial and physical help, they need that physical that mental support also. And in orphan children, though they are getting getting the support from maybe other guardians, other relatives or orphanages, whatever is there, other mentors or whatever, but that emotional support in many cases they are lacking. Okay, and that leads to this alcohol abuse, substance abuse and everything. Okay, now, talking about environmental indicators. So, these reflect the quality of physical and biological environment in which diseases occur and people live. The most important are those measuring the proportion of population having access to safe drinking water and sanitation facilities. Sanitation facilities again very important, and it is again something which is till now standing in 2025. It is very shameful to say this thing, but it is a reality in a country like India, where in many places, many interior places, many rural areas, there is still lack of proper sanitation. Okay, and it is a major factor for spread of diseases from person to person. Okay, so that is there. These indicators explains the prevalence of communicable diseases in a community, because most communicable diseases means the infectious diseases which are easily transferred from one person to other via direct or indirect physical contact. So that thing is it's spread in a much more wild manner if there is lack of sanitation facility. Okay, the other indicators will be those measuring the pollution of water and radiation, sorry, pollution of water and air, radiation, noise pollution, exposure to toxic substances in food and water. Okay, now moving on to the next group of indicators, that is socio-economic indicators. So these do not directly measure health but are important in interpreting health indicators. So these are basically indirect indicators. Directly it will not influence your health, but indirectly they will be playing an important role. So first is the per capita income. Next is level of unemployment, which is very high nowadays in India. We all know that most of the youth are unemployed even after having degrees like masters and PhDs. Okay, next is literacy rate, which is again very low in India. Okay, I think still 60% of the population is still illiterate in India. Per capita caloric availability, population, total fertility rate, family size, which is again big in India, in most of the families of India, population increase rate, and contraceptive use. Contraceptive use is again something important, which is in many cases in India, it's people avoid contraception. Okay, and many people, they have some religious beliefs also that we should not use contraception. Okay, next, coming to health policy indicators. So it's the single most important indicator of political commitment, uh, that is allocation of adequate resources. So there are some relevant indicators again, like proportion of GDP spent on health services, which is around 0.27%. But this is the data of 2011 to 12, so it's a much more much older data. Proportion of GDP spent on health related activities like water supply and sanitation and housing and nutrition. Proportion of total health resources devoted primary health care. Now coming to indicators of quality of life. So life expectancy is no longer important. The quality of life has gained its importance. Means it's not important that how much years you are living, but how you are living your life, that is important. Okay. So, talking about physical quality of life index, it consolidates infant mortality, life expectancy at age of 1 year, and literacy. For each component, the performance of individual country is placed on a scale of 1 to 100. The composite index is calculated by averaging the three indicators, giving equal weight to each. The result is placed on the 0 to 100 scale, and the PQLI does not consider the GDP. Okay, so talking about Human Development Index, so it's life expectancy at birth, literacy rate, income, that is GDP per per capita income, and the result is again placed on a scale of 0 to 1. Okay. Now, what will make an indicator smart? Means what will be the characteristics of a good indicator? So first is specificity. I think these are again something I have talked about earlier also in brief. So SMART. So first is specificity. Indicator is concrete, detailed, focused, and well defined. Next is measurable. Indicator tells how many or how much and can be measured with identified measurement sources. Next is agreed upon. Stakeholders vested in a specific M&E question should agree that the indicator is relevant. Next is relevant. Indicator generates data that can answer the question of interest. Next is time bound. Indicator specifies time frame of what it is measuring. Okay, now we need to consider some factors when we are selecting indicators. Okay, so first is logic or link to framework. Second is programmatic needs or information for decision making. Third is resources. Fourth is external requirements like government, donor, headquarters, etc. Next is data availability. Next is standardized indicators. And last is alignment with national and international standards. Okay, now when we are selecting an indicator, because we saw that there are different groups of indicators. So when we need to select a particular group of indicator, there are some common drawbacks or pitfalls. What are they? Number one, indicators not linked to program activities. Number two, poorly defined indicators. Number three, indicators that cannot realistically be collected. Number four, process indicators to measure outcomes and impacts. Number five, indicators that are insensitive to age. And now next is too many indicators. Okay. uh Again, talking about pitfalls in selecting indicators. So indicators not linked to program activities. So intermediate result can be there, that is expanded access to malaria treatment services, activities like train providers in current clinical protocols. Inappropriate indicator, that is percentage of facilities with adequate conditions to provide care. And better indicators will be number of clinicians trained, percentage of facilities with a trained provider. The program is not aiming to affect facility conditions, only provider skills. Next is data needed for indicator not available. So इसमें inappropriate indicator में क्या होगा? Percent of days per quarter that service delivery points have stock out of drugs. Next is data issue. Information on stockouts may not be collected daily. Next is better indicator, that is percentage of service delivery points that had a stock out of drugs at some point during the past quarter. If relying on routine data, an indicator definition must depend on how data is collected. Okay, now next is indicator does not accurately represent desired outcome. Access to effective treatment among children less than 5 years old with malaria. Inappropriate indicator में क्या होगा? Percentage of children less than 5 years old who received artemisinin based combination therapies, that is ACTs, which is done in case of malaria patients, and percentage of people who received ACTs for malaria infection who were children more than 5 years of age. Better indicator में क्या होगा? Percentage of children less than 5 years old who were diagnosed with malaria in the past 2 weeks who received ACTs. What does it mean if inappropriate indicators increase or decrease? Do they reflect the desired program effect? So these are the questions that we need to consider. Now talking about good indicators. So they will provide information useful for program design decision making, and they are consistent with international standards and other reporting requirements as appropriate. And they are defined in clear and unambiguous terms. They are non-directional or independent, and they have values that are easy to interpret and explain, precise, valid, and reliable measures, comparable across relevant population groups, geography, and other program factors as needed. Okay, so lastly, talking about the summary, that is guiding principles for selecting indicators. So first we need to ensure that the indicators are linked to the information needs for health interventions and are able to measure change. Next is we need to ensure that standard indicators are used to the extent possible. Next, we need to consider the cost and feasibility of data collection and analysis. And next, we need to keep the number of indicators to the minimum that are necessary and include only those needed for program and management decisions or for reporting. Okay, so I think that's it. We will be soon moving on to the next topic of this CUET PG hospital management preparation. So till then, thank you and goodbye. Please like, share, and subscribe ITLS Academy. Thank you.